101. A nurse is caring for a patient with a recent traumatic brain injury. The patient has a Glasgow Coma Scale, GCS, score of 7. Which of the following interventions is a priority? A. Administering oxygen therapy. B. Monitoring for signs of increased intracranial pressure. C. Giving pain medications as prescribed. D. Encouraging the patient to eat and drink. Answer. B. Monitoring for signs of increased intracranial pressure. Rationale. A GCS score of 7 indicates a severe level of consciousness impairment, making monitoring for increased intracranial pressure a priority. 101. A nurse is caring for a patient with a recent traumatic brain injury. The patient has a Glasgow Coma Scale, GCS, score of 7. Which of the following interventions is a priority? A. Administering oxygen therapy. B. Monitoring for signs of increased intracranial pressure. C. Giving pain medications as prescribed. D. Encouraging the patient to eat and drink. Answer. B. Monitoring for signs of increased intracranial pressure. Rationale. A GCS score of 7 indicates a severe level of consciousness impairment, making monitoring for increased intracranial pressure a priority. 103. A nurse is assessing a patient with a history of brain tumor. Which of the following symptoms would be considered a red flag and require immediate intervention? A. Occasional mild headache. B. Sudden onset of vomiting without nausea. C. Visual disturbances that are intermittent. D. Gradual memory loss. Answer. B. Sudden onset of vomiting without nausea. Rationale. Sudden onset of vomiting without nausea may indicate increased intracranial pressure, which is a medical emergency. 104. A nurse is caring for a patient who has just been diagnosed with a brain tumor. Which of the following symptoms is most likely associated with increased intracranial pressure, ICP? A. Sudden weight loss. B. Bilateral visual changes. C. Low blood pressure. D. Increased heart rate. Answer. B. Bilateral visual changes. Rationale. Visual disturbances, especially bilateral, are commonly associated with increased ICP due to pressure on the optic nerve. 105. A nurse is caring for a patient who has a history of seizures. Which of the following actions should the nurse take when the patient is experiencing a seizure? A. Place a tongue depressor in the patient's mouth. B. Restrain the patient to prevent injury. C. Protect the patient from injury by clearing the area. D. Administer an intravenous sedative immediately. Answer. C. Protect the patient from injury by clearing the area. Rationale. During a seizure, it's important to protect the patient from injury by removing nearby objects and positioning them safely. 106. A nurse is caring for a patient with a spinal cord injury at T6. Which of the following complications should the nurse monitor for in the acute phase? A. Autonomic dysreflexia. B. Postural hypotension. C. Urinary retention. D. Diabetic ketoacidosis. Answer. B. Postural hypotension. Rationale. Postural hypotension is common in patients with spinal cord injuries, especially in the acute phase, due to impaired sympathetic nervous system function. 107. A nurse is caring for a patient with a diagnosis of Bell's palsy. Which of the following interventions should the nurse include in the care plan? A. Administering corticosteroids as prescribed. B. Placing the patient in a high Fowler's position. C. Encouraging fluid restriction. D. Applying heat to the affected side of the face. Answer. A. Administering corticosteroids as prescribed. Rationale. Corticosteroids are often prescribed in the acute phase of Bell's palsy to reduce inflammation and improve recovery. 108. A nurse is caring for a patient with a traumatic brain injury who has a Glasgow Coma Scale, GCS, score of 15. Which of the following assessments should the nurse prioritize? A. Monitoring for signs of infection. B. Observing for any changes in the patient's level of consciousness. C. Checking for signs of increased intracranial pressure. D. Measuring vital signs every. Answer. B. Observing for any changes in the patient's level of consciousness. Rationale. Even with a GCS of 15, continuous observation for any changes in consciousness is critical as the patient's condition could deteriorate. 109. A nurse is caring for a patient with Parkinson's disease. Which of the following nursing interventions is most important to prevent complications related to the disease? A. Encouraging the patient to perform deep breathing exercises. B. Implementing a fall prevention program. C. Providing a high-calorie diet to prevent weight loss. D. Scheduling frequent ambulation breaks. Answer. B. Implementing a fall prevention program. Rationale: patients with Parkinson's disease are at a high risk for falls due to motor impairments, so implementing fall prevention strategies is a priority. 110. A nurse is educating a patient with Alzheimer's disease about medication management. Which of the following medications is commonly used to manage symptoms of Alzheimer's disease? A. Donepezil. B. Morphine sulfate. C. Diphenhydramine. D. Aspirin. Answer. A. Donepezil. Rationale: donepezil is an acetylcholinesterase inhibitor that helps improve symptoms and slow the progression of Alzheimer's disease. 111. A nurse is caring for a patient with Guillain-Barré syndrome who is experiencing ascending muscle weakness. Which of the following interventions should the nurse anticipate? A. Administering intravenous immunoglobulin (IVIG). B. Initiating chemotherapy. C. Restricting fluid intake. D. Performing regular deep tendon reflex testing. Answer. A. Administering intravenous immunoglobulin (IVIG). Rationale: IVIG is often used to treat Guillain-Barré syndrome as it helps reduce inflammation and improve recovery. 112. A nurse is caring for a patient with an ischemic stroke. Which of the following findings should the nurse report to the healthcare provider immediately? A. Hemiparesis on the left side. B. Dysphagia. C. Unequal pupils. D. Stable blood pressure. Answer. C. Unequal pupils. Rationale: unequal pupils may indicate increased intracranial pressure or brain herniation, requiring immediate attention. 113. A nurse is caring for a patient diagnosed with a brain tumor. Which of the following clinical manifestations would be a priority for the nurse to assess? A. Seizures. B. Fever. C. Edema. D. Pallor. Answer. A. Seizures. Rationale: seizures are a common complication of brain tumors and should be prioritized for assessment and management. 114. A nurse is assessing a patient who is at risk for stroke. Which of the following findings is most indicative of an ischemic stroke? A. Hemiplegia with sudden onset. B. Gradual loss of vision. C. Severe headache with nausea. D. Altered mental status with confusion. Answer. A. Hemiplegia with sudden onset. Rationale: hemiplegia with sudden onset is a classic sign of an ischemic stroke, often caused by a clot blocking blood flow to the brain. 115. A nurse is caring for a patient with a spinal cord injury at C4. Which of the following should the nurse be most concerned about? A. Respiratory compromise. B. Bowel incontinence. C. Difficulty swallowing. D. Loss of sensation in the legs. Answer. A. Respiratory compromise. Rationale: a C4 spinal cord injury can impair the diaphragm and breathing, leading to respiratory compromise, which is a priority concern. 116. A nurse is educating a patient with Huntington's disease about symptom management. Which of the following is the primary focus of care for patients with this condition? A. Providing medications to reduce muscle rigidity. B. Addressing the patient's cognitive and psychiatric symptoms. C. Administering anticoagulants to prevent stroke. D. Encouraging high-protein nutrition. Answer. B. Addressing the patient's cognitive and psychiatric symptoms. Rationale: Huntington's disease primarily affects cognitive and psychiatric function, and symptom management focuses on these aspects. 117. A nurse is assessing a patient with a history of epilepsy. Which of the following is a priority assessment during a seizure? A. Timing the duration of the seizure. B. Providing verbal reassurance to the patient. C. Asking the patient if they have a history of seizures. D. Measuring blood pressure every 15 minutes. Answer. A. Timing the duration of the seizure. Rationale: Timing the seizure is crucial to determine if it is prolonged, as seizures lasting longer than 5 minutes may require medical intervention. 118. A nurse is caring for a patient with a brain injury who is exhibiting signs of increased intracranial pressure. Which of the following is an early sign of increased ICP? A. Decreased level of consciousness. B. Fixed dilated pupils. C. High blood pressure with a widened pulse pressure. D. Severe headache and vomiting. Answer. A. Decreased level of consciousness. Rationale. A decreased level of consciousness is an early sign of increased ICP, as pressure on the brainstem affects neurological function. 119. A nurse is providing care for a patient with a recent ischemic stroke. Which of the following is a priority for the nurse in the immediate post-stroke period? A. Administering anticoagulant therapy. B. Ensuring adequate hydration and nutrition. C. Performing a swallowing assessment. D. Monitoring blood glucose levels. Answer. C. Performing a swallowing assessment. Rationale. Swallowing difficulties are common after stroke and can lead to aspiration. A swallowing assessment is a priority in the early post-stroke period. 120. A nurse is caring for a patient with multiple sclerosis, MS. Which of the following interventions is most appropriate to manage fatigue in MS? A. Encouraging frequent rest periods. B. Increasing the patient's physical activity. C. Providing a high-protein diet. D. Administering corticosteroids daily. Answer. A. Encouraging frequent rest periods. Rationale. Fatigue is a common symptom of MS, and encouraging rest periods helps manage this symptom. 121. A nurse is caring for a patient with a diagnosis of a transient ischemic attack, TA. Which of the following is the most important intervention in the immediate care of this patient? A. Administering fibrinolytics. B. Maintaining a calm and supportive environment. C. Initiating blood pressure monitoring. D. Preparing the patient for surgery. Answer. B. Maintaining a calm and supportive environment. Rationale. Patients experiencing a TJ may feel anxious. Providing emotional support and reducing stress are crucial. 122. A nurse is assessing a patient with a history of stroke. Which of the following findings should the nurse report immediately? A. Unequal pupils. B. Slurred speech. C. Sudden weakness in the arms. D. Difficulty swallowing. Answer. A. Unequal pupils. Rationale. Unequal pupils could indicate increased intracranial pressure or neurological deterioration, requiring immediate attention. 123. A nurse is educating a patient with a new diagnosis of Alzheimer's disease about memory enhancement. Which of the following recommendations is most appropriate? A. Using memory aids, such as a calendar and clock. B. Encouraging frequent use of medications. C. Limiting social interactions to reduce stress. D. Teaching the patient to avoid activities that require concentration. Answer. A. Using memory aids, such as a calendar and clock. Rationale. Memory aids, such as calendars, can help patients with Alzheimer's maintain orientation and promote independence. 124. A nurse is caring for a patient with a spinal cord injury at T10. Which of the following complications is the nurse most concerned about? A. Respiratory failure. B. Loss of bladder control. C. Gastrointestinal bleeding. D. Pressure ulcers. Answer. B. Loss of bladder control. Rationale. A T10 injury affects lower thoracic and lumbar regions, impairing bladder control, which is a major concern for spinal cord injury patients. 125. A nurse is caring for a patient with Parkinson's disease who has developed dysphagia. Which of the following is the most appropriate action to prevent aspiration? A. Keeping the patient in a supine position while eating. B. Encouraging the patient to eat soft, pureed foods. C. Administering a sedative before meals. D. Increasing the patient's fluid intake. Answer. B. Encouraging the patient to eat soft, pureed foods. Rationale. Dysphagia is common in Parkinson's disease, and soft, pureed foods can help reduce the risk of aspiration. 126. A nurse is educating a patient with seizures about safety precautions. Which of the following is most important for the patient to remember during a seizure? A. Bite down on a hard object to protect the tongue. B. Lie flat on your back to avoid injury. C. Do not try to restrain the body during the seizure. D. Place a pillow under the head to prevent neck injury. Answer: C. Do not try to restrain the body during the seizure. Rationale: restraining a patient during a seizure can cause harm. It's more important to ensure the patient is in a safe environment. 127. A nurse is caring for a patient with Guillain-Barré syndrome. Which of the following is a priority assessment in the acute phase? A. Monitoring respiratory function. B. Monitoring for signs of infection. C. Assessing for constipation. D. Checking for ankle edema. Answer: A. Monitoring respiratory function. Rationale: Guillain-Barré syndrome often leads to progressive muscle weakness, including respiratory muscle weakness, making respiratory monitoring crucial. 128. A nurse is caring for a patient with a history of seizures. Which of the following should the nurse include in the patient's education to help manage seizure activity? A. Avoiding alcohol consumption. B. Engaging in high-intensity exercise. C. Limiting sleep to 5 hours per night. D. Using over-the-counter cold medications. Answer: A. Avoiding alcohol consumption. Rationale: alcohol can lower the seizure threshold and increase the likelihood of seizures. Limiting alcohol is important for seizure management. 129. A nurse is caring for a patient with a brain tumor. Which of the following interventions is most important to prevent complications of increased intracranial pressure, ICP? A. Administering corticosteroids. B. Maintaining head of the bed at 30 to 45 degrees. C. Limiting fluid intake. D. Performing frequent neurological assessments. Answer: B. Maintaining head of the bed at 30 to 45 degrees. Rationale: elevating the head of the bed at 30 to 45 degrees promotes venous drainage, which can help reduce ICP. 130. A nurse is caring for a patient who has had a cerebrovascular accident, CVA, resulting in left-sided hemiplegia. Which of the following should the nurse prioritize? A. Assisting the patient with activities of daily living. B. Teaching the patient to use the unaffected hand. C. Assessing for signs of deep vein thrombosis, DVT. D. Encouraging the patient to stand unsupported. Answer: C. Assessing for signs of deep vein thrombosis, DVT. Rationale: patients with hemiplegia are at risk for DVT due to immobility. Monitoring for DVT is critical. 131. A nurse is caring for a patient with a diagnosis of Bell's palsy. Which of the following would be most important for the nurse to monitor in this patient? A. Facial asymmetry and weakness. B. Sudden loss of speech. C. Headache and neck stiffness. D. Nausea and vomiting. Answer: A. Facial asymmetry and weakness. Rationale: Bell's palsy causes facial nerve paralysis, leading to facial asymmetry and weakness, which should be monitored for signs of improvement. 132. A nurse is caring for a patient with a traumatic brain injury. Which of the following would be the most important to assess in the first 24 hours following the injury? A. Glasgow Coma Scale, GCS score. B. Patient's ability to speak. C. Hemoglobin and hematocrit levels. D. Electrolyte balance. Answer: A. Glasgow Coma Scale, GCS score. Rationale: the GCS score is a critical assessment tool in the early hours following a traumatic brain injury to monitor neurological status. 133. A nurse is caring for a patient with a spinal cord injury. The nurse is preparing to assist with transferring the patient from the bed to a wheelchair. Which of the following should the nurse consider? A. The patient should wear a neck collar during transfer. B. The patient should avoid use of any mobility aids. C. The patient should be positioned in a sitting position. D. The patient should have a caregiver's assistance. Answer: A. The patient should wear a neck collar during transfer. Rationale: patients with spinal cord injuries may require additional stabilization, such as a neck collar, during transfers to avoid exacerbating the injury. 134. A nurse is educating a patient with Alzheimer's disease on how to manage their condition. Which of the following should the nurse include in the teaching? A. Maintain a consistent daily routine. B. Avoid physical activity. C. Limit social interactions. D. Discontinue medications if symptoms improve. Answer: A. Maintain a consistent daily routine. Rationale: a consistent routine helps patients with Alzheimer's disease feel more secure and oriented, reducing confusion and agitation. 135. A nurse is caring for a patient with a spinal cord injury at C7. Which of the following interventions is most important in the acute phase? A. Performing passive range of motion exercises. B. Ensuring adequate fluid intake. C. Monitoring for respiratory distress. D. Assessing for autonomic dysreflexia. Answer: C. Monitoring for respiratory distress. Rationale: a C7 injury affects respiratory function, so monitoring for signs of respiratory distress is critical in the acute phase. 136. A nurse is caring for a patient with a seizure disorder. Which of the following would be the nurse's priority action during a seizure? A. Protecting the patient's head. B. Restraining the patient's limbs to prevent injury. C. Administering antiepileptic drugs immediately. D. Checking the patient's blood pressure. Answer: A. Protecting the patient's head. Rationale: protecting the head is a priority during a seizure to prevent injury. Restraint is not recommended, and medications should be given after the seizure. 137. A nurse is caring for a patient with a brain tumor. Which of the following should the nurse monitor for as a sign of increased intracranial pressure? A. Bradycardia. B. Hypertension. C. Changes in the patient's level of consciousness.
D. Tachypnea.
Answer: C. Changes in the patient's level of consciousness. Rationale: changes in consciousness are an early sign of increased ICP, requiring prompt intervention. 138. A nurse is caring for a patient with trigeminal neuralgia. Which of the following should the nurse include in the patient's teaching? A. Avoiding hot and cold foods. B. Using over-the-counter analgesics frequently. C. Limiting physical activity. D. Avoiding stress. Answer: A. Avoiding hot and cold foods. Rationale: trigeminal neuralgia causes pain triggered by temperature extremes, so avoiding hot or cold foods helps reduce discomfort. 139. A nurse is caring for a patient diagnosed with a glioblastoma. The patient is experiencing increasing confusion and restlessness. Which of the following actions should the nurse take first? A. Assess the patient's neurological status. B. Notify the healthcare provider immediately. C. Administer a sedative as prescribed. D. Check the patient's vital signs. Answer: A. Assess the patient's neurological status. Rationale: the first action should always be to assess the patient's neurological status to determine if the confusion and restlessness are due to increased intracranial pressure. 140. A nurse is caring for a patient with a brain tumor. The patient reports sudden, severe headache. Which of the following should the nurse do first? A. Administer pain medication. B. Assess the patient's neurological status. C. Elevate the head of the bed. D. Notify the healthcare provider. Answer: B. Assess the patient's neurological status. Rationale: a sudden, severe headache could indicate increased intracranial pressure, so assessing the neurological status is a priority. 141. A nurse is caring for a patient with a history of stroke. Which of the following interventions is most important during the acute phase of stroke? A. Monitoring for signs of a seizure. B. Administering antiplatelet therapy. C. Elevating the head of the bed. D. Maintaining the patient's airway. Answer: D. Maintaining the patient's airway. Rationale: maintaining airway patency is crucial in the acute phase of a stroke, as impaired airway clearance can lead to respiratory distress. 142. A nurse is caring for a patient with multiple sclerosis, MS, who has difficulty with coordination. Which of the following is the most appropriate nursing intervention? A. Assist the patient with range of motion exercises. B. Encourage the patient to walk without assistance. C. Ensure the patient is in a dark, quiet room. D. Help the patient use assistive devices for walking. Answer: D. Help the patient use assistive devices for walking. Rationale: multiple sclerosis affects coordination. Using assistive devices for walking improves safety and independence. 143. A nurse is caring for a patient with Guillain-Barré syndrome. Which of the following is the priority nursing intervention? A. Administering antiviral medications. B. Monitoring for respiratory distress. C. Encouraging the patient to eat small meals. D. Providing emotional support to the patient. Answer: B. Monitoring for respiratory distress. Rationale: Guillain-Barré syndrome can lead to respiratory muscle weakness. Monitoring for respiratory distress is crucial. 144. A nurse is educating a patient with Parkinson's disease about medication management. Which of the following should the nurse include in the teaching? A. Medication should be taken at the same time every day. B. Increasing the dosage of levodopa as symptoms improve. C. Discontinuing medication once symptoms improve. D. Taking levodopa on an empty stomach only. Answer: A. Medication should be taken at the same time every day. Rationale: consistent timing of Parkinson's medications helps maintain a steady level of the drug in the system, optimizing symptom management. 145. A nurse is caring for a patient who has just undergone a craniotomy. Which of the following findings should be immediately reported to the healthcare provider? A. Headache and nausea. B. Disorientation and confusion. C. A fever greater than 100 degrees Fahrenheit 37.8 degrees Celsius. D. Seizure activity. Answer: D. Seizure activity. Rationale: seizures after a craniotomy are a medical emergency that requires immediate intervention to prevent further neurological damage. 146. A nurse is caring for a patient with a spinal cord injury at T5. Which of the following is most important for the nurse to monitor in the first 24 hours? A. Respiratory function. B. Bladder and bowel function. C. Signs of autonomic dysreflexia. D. Cardiovascular function. Answer: A. Respiratory function. Rationale: a T5 injury may affect the sympathetic nervous system and respiratory function. Close monitoring is critical during the first 24 hours. 147. A nurse is assessing a patient with a diagnosis of Alzheimer's disease. Which of the following is an early sign of Alzheimer's disease? A. Progressive loss of memory. B. Inability to recognize family members. C. Complete loss of motor skills. D. Sudden onset of severe headaches. Answer: A. Progressive loss of memory. Rationale: early signs of Alzheimer's disease often include short-term memory loss, confusion, and difficulty learning new information. 148. A nurse is caring for a patient with a spinal cord injury at C4. The nurse should be most concerned about which of the following complications? A. Spinal shock. B. Difficulty breathing. C. Increased heart rate. D. Decreased blood pressure. Answer: B. Difficulty breathing. Rationale: a C4 spinal cord injury may result in paralysis of the diaphragm, affecting respiratory function. Immediate concern is respiratory compromise. 149. A nurse is caring for a patient who has had a stroke and is experiencing difficulty swallowing. Which of the following is the most appropriate nursing intervention? A. Place the patient in a supine position while eating. B. Provide thickened liquids and soft foods. C. Encourage the patient to drink through a straw. D. Limit fluid intake to prevent aspiration. Answer: B. Provide thickened liquids and soft foods. Rationale: thickened liquids and soft foods help reduce the risk of aspiration for patients with dysphagia after a stroke. 150. A nurse is caring for a patient with seizures. Which of the following actions should the nurse take if the patient begins having a seizure? A. Place a padded tongue blade in the patient's mouth. B. Restrain the patient's limbs to prevent injury. C. Turn a patient to the side to prevent aspiration. D. Administer anti-seizure medication immediately. Answer: C. Turn the patient to the side to prevent aspiration. Rationale: Turning the patient to the side during a seizure helps prevent aspiration and ensures the airway remains clear.